Injuries, usually to the muscles or tendons, are the bane of anyone involved in weight training or any type of athletics or sports. So anything that could possibly increase the healing process is of great interest to anybody who's involved in weight training. In the last couple of years, there's been a couple of experimental compounds that have generated quite a bit of publicity over the internet. Some of these things are known as peptides. I've done previous videos on peptides. Peptides are short chains of amino acids. And in this particular video, I'm going to talk about one of the most popular experimental peptides. It's a synthetic peptide, but it also is produced in the human body. It's called BPC-157. BPC, the BPC part stands for body protection compound, which kind of accurately describes what it does in the body. It's a very protective and healing compound, and it's thought to accelerate the healing of injuries, particularly connective tissue injuries, which are notoriously hard to heal because of the poor blood supply of connective tissue in comparison to muscle. Muscle has a lot of blood vessels, tendon usually does not. That's why it takes so much longer to heal. So anyway, BPC, I'm just going to call it BPC instead of BPC-157, but you know what I'm referring to. BPC was initially described in 1993. It was found to be a natural substance produced in the gastric mucosa. That's the stomach lining. It's produced in the gut. And it was found to initially help heal ulcers and other problems in the intestinal tract. Now, ulcers, by the way, are usually gastric ulcers are caused by an organism called H. pylori. That I don't want to get into that, but basically BPC was found in these early experiments to greatly accelerate the healing of ulcers, and it's actually produced by the gut mucosa. Your body can sense when there's an ulcer there, and it actually produces BPC in the body normally to accelerate the healing. In other words, it's a reaction by the body to accelerate healing of ulcers. That's what the original study showed. And as I said, what it is, it's a peptide. It means it consists of a small string of 15 amino acids in a particular sequence. And that first study noted that all organ systems benefit from BPS activity, not just the stomach, but various intestinal and internal organs can also have BPC can also offer a healing effect for them also. But I want to quickly state at the onset, this is kind of an important concept, is that just about every study, I'm going to discuss a couple of the studies that they published on BPC-157, but you should know that just about every study was an animal or an in vitro study. In other words, it involved lab animals like rats, or it involved isolated cells or in vitro. Almost none of them were human studies. Most of the information that you hear about on the internet, where people have said that they've got great benefits of BPC or TB500, which I'll be discussing in another video, is what they call in science anecdotal information. In other words, it doesn't mean that it's not producing effects. What it means is that there's no real actual human evidence that it does. But again, this doesn't mean that it doesn't work. It just means that, if you're in the medical literature, there's nothing to prove that BPC does the things that it's said to do. And there's a reason why it hasn't. There's not a lot of human studies, which will become apparent later on when I tell you why. BPC appears to work by promoting the release of various healing growth factors, not growth hormone, other growth factors, which aid the healing process. It also appears to positively affect the release of nitric oxide, which dilates blood vessels and increases the blood circulation to damaged tissues of the body. Of course, when you increase the blood circulation, you increase the delivery of oxygen and healing nutrients, which is why nitric oxide helps to accelerate healing. A 2018 study found that the healing effects extended beyond the gastrointestinal tract. I'm talking about BPC. Specifically appeared to help stabilize the lining of blood vessels of the endothelium. The endothelium is the lining of blood vessels. And by doing so, it helps to prevent the formation of clots that can initiate a heart attack or stroke. So in that sense, BPC offers some cardiovascular protection. BPC, of course, aids in the healing of muscle and tendon injuries by increasing the expression of vascular endothelial growth factor, or VEGF, which promotes the development of new blood vessels. Again, the problem with connective tissue is that it's not very rich in blood vessels, and that's why it takes so long to heal. By accelerating the release of VEGF and other growth factors, BPC would greatly accelerate the healing of connective tissue injuries, such as tendons and that type of thing. Note that tendons, as I said, with connective tissue have a poor blood supply. BPC likely helps to heal connective tissue because it increases blood supply to injured connective tissue, which greatly speed healing. As I said, a 1999 study that featured rabbits as study subjects found that BPC-157 accelerated the healing of bone and muscle injuries. However, this study, as is true with most other existing studies, involved providing BPC in intramuscular form. You should know that BPC, because it's a peptide, a short chain amino acids, it's not very stable when ingested orally, because when you ingest it orally, it'll be broken down by the stomach acids, and it'll just basically be broken down into constituent amino acids and have no biological activity. However, some of it does seem to get by, because studies show that after an oral intake of BPC-157, 36% of it showed up in the blood plasma. So apparently some of it does somehow, get absorbed. And, peptides are known to be somewhat absorbed in the gut, although not completely. Any type of peptide is always best administered, including BPC, by an injection. In this case, either the usual route is subcutaneous, or injection right under the skin in the affected area, or you can ingest it intramuscular, which is a little bit more difficult. But when you do that, you're getting the full potency of BPC-157, contrary to what you might read on the web, where they're trying to sell you oral versions. The oral versions will never work as well as the injectable. I'll tell you right now, they never will, no matter what you read. A 2010 study found that BPC greatly accelerated tendon healing by promoting the activity of fibroblasts. These are tendon precursor cells that stimulate the production of collagen. Collagen is the baseline protein of connective tissue. So if you stimulate collagen, you're going to stimulate the healing of connective tissue. So that's another way that BPC accelerates connective tissue healing. A 2015 study investigated whether BPC-157 could accelerate the healing process of burn wounds in rats. Again, another rat study. The study found that BPC-57 promoted the release of several growth and healing compounds, as well as VEGF, which again increases blood flow to injured areas. So it's good for wounds healing, it's good for burn healing, just about any type of healing. A 2017 study involved rats found that providing either BPC-157 or the amino acid arginine could reverse and prevent the damage to the stomach, liver, and brain tissue caused by ingesting non-steroidal anti-inflammatory compounds such as ibuprofen, Celebrex, and several others. These things can cause a lot of damage to your intestinal lining and other tissues. And they do that by interfering with the production of nitric oxide, so that basically the blood circulation of the tissues is blunted, so then the tissues aren't getting enough oxygen nutrients, so they get damaged. But BPC or arginine, because arginine is the direct precursor for nitric oxide, either one of those things appears to offset these negative consequences of using non-steroidal anti-inflammatory drugs, which are very popular and often used to treat injuries, just like BPC. They use to treat tendon, muscle, and various other aches and pains, but they do have a lot of side effects, especially when used in larger doses. A friend of mine, champion bodybuilder a couple of years ago, he was taking 15 ibuprofen a day for 5 years and went into kidney failure. He had to have a kidney transplant. This guy was a national champion. It led to his retirement from bodybuilding. He was a professional at the time he retired. Today he still works out, but he went from off-season weight of a little over 300 pounds. He walks around today weighing about 160 pounds and is unrecognizable as a bodybuilder. Nice guy, though. He's happy, though. I spoke to him. It's no problems. Anyway, BPC-157 can also prevent, it's Tom Prince. I'll give you the guy's name. I mean, you guys probably already know what happened to him. So, he sells real estate. He's happy. So, What BPC-157 can also prevent nervous system problems related to gut inflammation. A 2018 rat study found that BPC-157 can offer neuroprotective effects through its activity in the gut. BPC modulates the release of serotonin, a brain neurotransmitter, as well as dopamine, another brain neurotransmitter, and it also beneficially affects various behavioral disturbances that otherwise appear due to specifically overstimulated or damaged neurotransmitters. In other words, BPC can potentially help balance neurotransmitter production in the brain, which would aid a lot of things: depression, mania, all these things. So it's good for the brain. A 2017 study found that BPC-157 can counteract the negative effects on heart function caused by several types of tranquilizing drugs. This involved a disturbance in heart rhythm, haloperidol. There's several others that are given to patients with various types of, let's say, schizophrenia, psychosis. These drugs, unfortunately, have a tendency to cause a certain type of heart rhythm disorder. Apparently, BPC can counteract that. Again, this was a rat study. Whether it happens in humans still remains to be seen. BPC-157 may be especially useful for those who suffer from many gastrointestinal diseases, such as Crohn's disease, irritable bowel syndrome, and other intestinal maladies because of its accelerated healing effects. In fact, I would strongly suggest that anyone who's watching this that has any of those common intestinal diseases, Crohn's or IBS, you might want to try BPC-157 because it's extremely healing in that particular part of the body, the gastrointestinal tract. It's very, very healing in that area. It might help you. There's a good chance it'll make you feel better. It does this through stimulating the activity of VEGF, vascular endothelial growth factor, as I said, which increases the circulation of blood and aids healing. BPC can also prevent the onset of cardiovascular disease. Those who have cardiovascular disease usually show lower levels of VEGF, and low VEGF level is also associated with Alzheimer's disease. So by stimulating, again, VEGF, BPC might help to prevent cardiovascular disease and even to a certain extent Alzheimer's disease, because one of the main problems with Alzheimer's disease is a lack of circulation to the brain, which starves the neurons of oxygen and nutrients, and they die off, and you get Alzheimer's. That's one aspect of it. That's not the whole thing of Alzheimer's. There's other factors that's beyond this video. Injecting VEGF directly would not be a good idea. In other words, you might say, well, why not cut to the chase and just inject VEGF, which also would need to be injected? Well, the problem with that is VEGF is an extremely potent stimulator of new blood vessel formation. And if you know anything about cancer, tumor cells metastasize or spread by actually manufacturing their own VEGF, which causes the development of new blood vessels, because tumors cannot metastasize or spread unless they develop new blood vessels. In fact, some of the latest treatments of cancer work by treating tumors with drugs that blunt VEGF, because without the new blood vessel formation, or angiogenesis as it's called, tumors just shrink up and die. They don't spread. So it's actually a new way of treating cancer. So you never want to inject VEGF directly, because it might, if you have, let's say, a dormant tumor in your body, it might activate it and you wind up getting cancer. It's not a good idea. Now you might say, well, wait a minute, since BPC-157 stimulates VEGF, wouldn't that also stimulate cancer? Well, the answer to that is all the animal studies that have known, it's never been known to stimulate any tumor formation whatsoever. And the idea is that it stimulates just, let's say, the normal amount of VEGF, not enough to, work with tumors to stimulate tumor metastasis. It'll only stimulate the formation of new blood vessels to feed injured areas. In other words, it's kind of a localized effect that won't stimulate cancer. That's the general thought about BPC-157. In other words, it's not related to cancer. In the brain, as I said, BPC helps to repair damaged brain cells, again, likely through increasing the blood supply, oxygen supply, and nutrient delivery to injured brain cells. Many of the existing studies about BPC did involve intramuscular administration, and since it's a peptide, as I said earlier, ingesting it early would lead to breakdown in the gut. And I've looked at various sites all over the internet that sell BPC, and a lot of them are selling in oral form, which I personally don't think would work very well. As I said, some of it is absorbed, but you're going to get at least twice as much benefit if you, or even more, maybe 3 times more benefit if you use the injected peptide, because again, it's not going to be broken down in the gut as will the oral version. Uh, Again, BPC has been shown to be effective systemically when injected once daily at a dose of anywhere from 1 to 10 micrograms per kilogram of body weight. In most cases, this comes out to a dose of anywhere from 200 micrograms up to 800 micrograms. Some people have used more, but I don't know. Again, there's no research. They're in unknown territory. It's like these people that use 20 units a day of growth hormone. Nobody really knows what the long-term effects are, but there's a suspicion that they're not very good. And there are side effects with those kind of dosages. So, in regard to anything like this, peptides or any type of growth factors, you always, as a rule of thumb, you always want to use the minimal amount that gets the job done. In other words, with BPC-157, if you get healing from a dose of 200 to 250 micrograms, stick with it. Don't increase it to 800 micrograms thinking it'll heal you faster. Because with any substance, the greater the dose, the greater the chance of side effects. Always keep that in mind. Some folks have reported success dosing twice daily with doses of 250 to 300 microgram for a total of 500 to 700 micrograms per day. Some guys will tell you that you could take BPC by spraying in the mouth, holding it in your mouth for 90 to 120 seconds, or in other words, a minute and a half to 2 minutes, and then swallowing it. I'm not a big, I don't buy that. I just don't buy it. I don't think you're going to get nearly the effects of BPC by taking it orally. I don't care if you hold it in your mouth for 10 minutes, it's still not going to be the same as an injected form. Again, because it's a peptide. As I said, the best routes for injection are intramuscular and subcutaneous. Subcutaneous is right under the skin. Subcutaneous is a lot easier to do. And that's probably the optimal way, I think, to take BPC-157 is through a subcutaneous injection in the site where you want the healing, whether it's the shoulders, elbows, that type of thing. Got to be careful about that, though. You can injure the tissue if you inject it wrong. But then again, remember, it's only subcutaneous. It's a superficial injection. It's right under the skin, so it's not going to heal the internal parts of, let's say, your shoulder. It's not going to go into the shoulder structure, so it's not going to mess up anything inside the shoulder because it's only literally in the top surfaces of the skin. Intramuscular is a little bit more problematic, but it could be injected that way. But I believe that based on the research I've done, that subcutaneous is the best route. Studies show that, as I said, a 36% of an oral dose of BPS shows up in the plasma an hour after oral ingestion. But why settle for 36% when you get 100% through a subcutaneous injection? Doesn't make any sense to me. Now you should know that I've said this in past videos. I'll say it again. My personal problem with BPC, and I've never used it. Honestly, I've never used it. But the reason I haven't used it is because I'm very, very, very suspicious of internet sources of substances like peptides, because they're not made by any legitimate drug company. They're made by these, I don't want to call them fly-by-night, maybe because I don't know the people who run these companies. A lot of the BPC comes from raw material made in China, which also bothers me. China has the lowest quality control of any country on the face of the earth. And my point is that the BPC-157, apparently from anecdotal reports, most of those people who've used it have reported to me that it seemed to help them. It worked. I'd say about 8 out of 10 people I've spoken to about BPS-157 over the past decade, I would say 9 out of 10 of them reported definite accelerated healing. Joint, the shoulders, and some guys use it on their pectorals and stuff like that. They've all reported. So it probably is genuine article, that you get over the internet, but I still have my doubts because there's so much fake stuff. Like in my Applied Metabolics newsletter, I recently wrote an article on SARMs, selective androgen modulator drugs. They're also experimental drugs, just like BPC-157. They're only sold on the internet. They're not made by any legitimate drug company. And a analysis of 50 different SARMs purchased from 50 different internet outlets showed that most of them, more than half of them, did not contain the amount of SARMs listed on the label or it did not contain SARMs at all, or it contained something that was it contains something other than actual SARMs. So that's, all right. You might say, well, that's SARMs. It doesn't necessarily mean it's going to happen with BPC, but I I have some misgiving. Well, here's the thing. Here's the way you can tell. If you use the BPC works very rapidly. And in fact, some people notice healing in as little as 10 days, and usually it shows up after about 2 weeks of using the dosages that I mentioned earlier. If you don't notice any healing effects after 2 weeks, unfortunately, you probably got fake or underdosed BPC. It's not real. You should see some acceleration of healing within 2 weeks. If you don't, it's likely fake. That's one good way of figuring it out. BPC works. Now, here's a question. If BPC works so well, you might wonder, why isn't it sold as a drug or prescribed by physicians? Very simple answer. BPC is a natural compound. It's not subject to patent protection. So drug companies, if they can't patent it, that's how they make a lot of money. They get patents on the drug so no one else could sell it, and they could charge the public whatever they want for it. This is a big controversy going on now in the pharmaceutical industries. They're selling some drugs for thousands of dollars. It doesn't cost them thousands of dollars to make these drugs. Some of these drugs, it cost them $1, and they're charging $18,000 a month. They can do that. There's no restrictions on it. It's a disgusting system. The drug companies can charge you whatever. Look what's going on with insulin. Insulin is a dirt cheap drug. They're charging people hundreds of dollars for insulin. I mean, they get away with murder, but they can do this especially with patented drugs, because that's the way it's set up. But the drug companies can't patent BPC-157 because it's a natural compound, so they can't mark up the price and sell it for thousands of dollars, which they would if they could. So that's why it's not sold by any drug company. Why don't physicians prescribe it? Simple. BPC is an experimental synthetic peptide which has never been approved for human usage by the Food and Drug Administration. That means theoretically it's illegal for any licensed physician to prescribe it. However, I know of many physicians, off-label they call it, that recommend BPC-157 to their patients to accelerate various types of healing of connective tissue injuries, muscle injuries, but they can't officially prescribe it. They'll just say something like, well, you might want to try this BPS-157, but they won't actually give it to the patient. The patient has to get it on their own, and they'll get it through the internet. Some doctors do that. Most doctors don't. So that's why you won't, you won't see doctors prescribing it. The good news about BPC is that there's there's no human studies, but on the other hand, there's never been any adverse effects reported about BPC by anyone who's used it. Now, nobody's ever gotten any toxic effects, even using higher dosage of BPC. I'll leave. The last thing I'll say about BPC is, if you want to have the best results, my feeling is that you should also consider using other supplements that will work with BPC and accelerating the healing. Some of these things are like raw materials for connective tissue synthesis or development. I'm talking about, let's say, collagen peptides, fish oil, which reduces inflammation and speeds healing, curcumin, turmeric, which also decreases inflammation and speeds healing, and glucosamine sulfate, which works within the joints and would work very well with BPC to accelerate connective tissue healing. So that's about it. I've been thinking about writing about BPC and TB500 in my Applied Metabolics newsletter. But be honest with you, I mean, the animal research is pretty impressive, as I just relayed to you, but I don't feel comfortable writing about a substance that is experimental and has literally no human evidence to back it up. Because everything I write about in Applied Metabolics is what I call evidence-based. In other words, there's some human evidence to show some efficacy. Some substances show more efficacy than others, but nearly everything I write about has at least some scientific background related to direct human usage. BPC and TB500 do not. They're strictly experimental compounds. All the evidence for them is in animals. And again, I reiterate, doesn't mean they don't work. As I said, most of the people that I've spoken to who have used BPC 157 have noted that it does seem to accelerate healing. Some people report better results than others. I've spoken to some guys that noticed that they felt better within a week. Other guys used it for a month and said it hardly did anything. So why the difference? Probably related to dosage. The guys that didn't notice anything probably didn't use enough of it, or maybe they used an oral form of it where most of it got broken down in the gut. I didn't really go into detail with these guys, so I didn't know how they took it, but that explains the differences in people's experiences using it. As I said, it's not a placebo effect. It does aid healing. I am convinced of that. But if you buy BPC-157 over the internet and you don't notice any difference after about 2 weeks where you're injecting it, it's fake. It doesn't work, because you should notice some difference. If you're using the dosages that I mentioned earlier, you should definitely experience at least some healing. Again, some people will be more healing than others, but if you experience nothing at all, you've likely bought probably sterile water. And that's the problem with the internet. So I'll leave it at that. If you want further information about nutrition, exercise, science, hormonal therapy, anti-aging research you can use today, fat loss techniques that really work, ergogenic aids, supplements that work, supplements that don't. I'm going to tell you the truth. I'm not associated with any supplement company. I'm going to tell you the whole truth. I don't give a crap what these people think about me. My deal is to tell 100% truth, because that's what I always wanted when I compete in body. I wanted to know the truth. And today we're in a sea of lies and misinformation. I mean, the internet's a great thing, but it's just loaded with, the only word I can think of is bullshit. You never know when what you're reading or hearing is the truth. But I'm going to tell you the truth, because I have no access to grind. I'm not associated with any supplement company. I'm not associated with any bodybuilding magazine. I don't give a crap what they write about me. Makes no difference. I'm going to tell you the truth. That's my goal. And I do that 100% in my Applied Metabolics newsletter. So subscribe today. It's 40 to 50 pages. No ads. I'm not trying to sell you anything. It's written on a simple 6th grade level. Anybody who knows how to read will be able to readily understand everything I write in Applied Metabolics. I'm not writing in medical journal style like some of these other digital publications. You'll be able to understand every word. And if you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information about nutrition, exercise, science, and general health and medicine. That's only for subscribers. It's a private, closed-off page. I also have an email portal on my Applied Metabolics website. Again, strictly for subscribers. You can send me short questions. I'll be happy to answer it. Only for current subscribers, though. I don't answer unsolicited questions. I don't have the time. And my subscribers who support my work, they always come first. Again, you're welcome to leave comments under the videos. If you want to leave suggestions for future videos, I will consider them. If I feel that they're going to relate to a large number of people. Some of the stuff that I've gotten a couple of comments on substances that just literally have no research at all. Some of these, for example, there was a couple of those so-called testosterone boosters. I've been asked to do videos on them. There's just nothing to talk about. There's no research. It's like two rat studies. What are you going to talk about? Everything I would say if I did a video on that would be purely anecdotal, based on nothing. And when you're dealing with that stuff, there's a lot of what they so-called placebo effect, where a lot of the effects could be in your head. In other words, you believe it's going to work, so it works, but it's not the actual stuff doing it. So that's why I don't do videos on those stuff, because there's simply nothing to say. The only people who would do videos on that stuff are people selling the stuff, and I'm not selling the stuff. So I'm not going to do videos on that stuff. So anyway, sorry about the rant. Subscribe today to my Applied Metabolics newsletter, www.appliedmetabolics.com. And if you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. They're great. They're great animals. Take care. This video went a little long, but I hope you get some benefit out of it.